Good evening, and thank you to everybody for coming. It's a thrill to see such a huge crowd here. Can you hear me? No.
Yep.
Nope.
They give you a hand mic?
Nope.
Take mine.
Okay. Okay, everyone, try it again. Thank you for coming. We're thrilled to see this huge crowd here. Each year it gets bigger, and I think it's doubled from the last time we did this, so it's a thrill to see such a big crowd. And I think, no doubt, some of the reason is the two women that I'm honored to be sitting up here with, Senator Slotkin and Dr. Salyer, who have incredible life stories and have made an incredible contribution to ovarian cancer and to the world. So let me start with Dr. Salyer. Can you give a little bit about the basics about how you happen to become interested and involved in dedicating your life to ovarian cancer cures and treatment?
Yeah, absolutely. So I'm a GYN oncologist, so I'm a physician that takes care of women with cancers in their reproductive organs. That entails I'm a surgeon, I'm a medical oncologist rolled into one. I lead clinical trials and do research. I got interested in oncology, I think, from an early age. My own father passed away from esophageal cancer, and interestingly, we also went bankrupt as a consequence of all of our medical bills, lost our house, all of our cars. As a college student, I had to get 3 jobs to get through college. So then, when I went to medical school, I became really interested in women's health. I also have a public health background with interest in health policy. So when I went into residency, I found GYN oncology as this perfect intersection of taking care of people with cancer, getting to do research, and be an advocate.
Thank you. A lot of the people in this room obviously have experience in their own family and friends with ovarian cancer, but a lot of other people don't. And I know that even though I've had experience, 'cause my sister is an ovarian cancer survivor, I have learned so much about what the symptoms are and what to watch for and what the treatments are by coming to these events. So if you could be very basic and kind of educate the room, because assuming that there's a lot of people that are hearing this for the first time.
Oh, for sure. You know, as we saw in those slides, over 80% of women are diagnosed with ovarian cancer in advanced stages. And that's because the symptoms are very subtle. It's very, you know, what seems insignificant, bloating, feeling full early, changes to your bowel or bladder habits, you know, maybe a little bit of pain here and there. Oh, my pants are a little bit tighter than they were a couple weeks ago. And I find especially women, we are so busy taking care of our families, our jobs, this and that. It's so easy to sweep those things under the rugs. And also doctors tend to sort of dismiss it, like, oh, you ate something wrong, you know? And because of that, it's often diagnosed very late. So it's these subtle symptoms that pop up. And unfortunately, when it's in early stages and just in the ovary itself, there's usually no symptoms at all. That's why research like this is important, because we know can't rely on symptoms alone to find this cancer early.
If people take a look on your table, and you might want to take these home with you or glance at them now and put them in your pocket, there are the early symptoms that Dr. Salyer just described. Tina's Wish has prepared a pamphlet that you can take with you, and that we also would be pleased if there's people that are not here that you'd like us to mail a notice about this to. Give it to us before you leave, and Tina's Wish will get that in the mail. Dr. Salyer, could you explain about the risks, how someone can decrease their risk, and what puts people at a special risk, such as the BRCA gene, and then the Lynch syndrome that we heard on the video?
Oh yeah, absolutely. So, you know, the good news is that in the general population, the risk of ovarian cancer is relatively low. It's only about 1%. So the big thing that we look for that puts you at a higher risk is if you have a family history. So family history of things like breast or ovarian cancer. But the thing to know is that mutations like you mentioned, like BRCA or Lynch, can also be passed down from the paternal side, right? And so they're not going to have those cancers. There may be things like pancreas, colon, skin, or male breast cancer. Those would also be a sort of red light that should go off that, oh, maybe I might be at higher risk for ovarian cancer as well. So one of the most important things is kind of chatting with your family and knowing that this history exists. One thing that I found is that a lot of families don't talk about it. Sometimes it gets kind of swept under the rug about exactly what diagnosis they had. This is especially common among women of color, where things like ovarian cancer just aren't discussed. So it's very, very important to know your history, talk to your family members, know exactly what they had, in both sides, so mom and dad's side. And then in terms of risk reduction, in general, it's kind of the things that we should be doing to be healthy anyway. So eating a well-balanced diet, getting exercise, getting good sleep, reducing stress. We know all these things reduce risk of all kinds of cancers. There is also an association between birth control use and reducing ovarian cancer risk. So if you've used birth control for at least 5 years in your life, that reduces your risk by 50%. And that risk reduction actually stays on for 30 years. So if you used it in your 20s, it's still helping you out in your 50s, which is pretty interesting.
Senator Slotkin, I know you've had, your mom suffered from ovarian cancer. Could you speak a bit about her and about that?
Hi, everybody. Thanks for having me, and thanks to Tina's Wish for just doing great work. So I grew up actually, I'm a Jewish woman. I grew up in a Jewish family, and so...
Let me stop you a second.
Oh.
Is this echoing in the room?
Sorry.
Okay, it's just echoing up here. Okay.
Okay. Yes. No. There's my mom on the screen there, and my brother and I. I believe it looks to me that she put makeup on us in that picture. So that tells you a little bit about my mom. She had a big personality. Her big dream for me was I was going to be a Broadway actress, by the way. So I failed. But I grew up in the shadow of knowing that her mother, my grandmother, had died at 39 from ovarian cancer. And the only symptom that my mother sort of passed on to me and sort of told me about was that she finally went to the doctor when she was wearing maternity clothes as a regular non-pregnant woman walking around the world, right? She'd already had her children, and her ovarian cancer was the size of a volleyball by the time they diagnosed her. And we still had her files, her medical files, like hard copy that we had kept in the family because my mom was an early breast cancer survivor. She had a double mastectomy and a lympectomy at 31 years old. So she was at a high risk, and we knew that. She was, what complicated her story was that she could not afford health care. I think just something to remember for folks, obviously, healthcare was very expensive. It is very expensive, but before Obamacare, it was totally legal to charge someone more if they happen to have a pre-existing condition. And having a mastectomy and lymphectomy at 31 is an easy pre-existing condition. So she could not afford the insurance that was on offer to her. She went 5.5 years without insurance. We helped her get insurance, and she let it lapse, and then walked into an ER with pain and was diagnosed with stage 4 ovarian cancer. I think for me, there was my first parent to get sick. I was 32 years old, and my parents are divorced, so I was responsible for her care. Of all the things I've done in my life, 3 tours in Iraq and tough things at the Pentagon and the CIA, nothing was worse than her first month after being diagnosed, and that desperation you feel to get someone the tests they need, the care they need, the emergency surgery they need. And by the time she had the surgery, they sort of came back very quickly after, and it was just she was too far gone. And the surgery was over kind of before it started, and she lasted another 18 months. But passed away this month in 2011, so 14 years ago.
Wow. Well, it's a sad story. So you mentioned funding and so you mentioned we're going to switch a little bit now to talking about funding for research and funding for healthcare. If we could, Tina's wish as people, as we've talked about earlier, funds research all around the country with private donations, money that's donated, but of course the research studies also involve funding from NIH or DOD or other government entities. Could you explain a little bit about that?
Sure. I mean, I think, most people understand that there's kind of a funding ecosystem around new research, and that's not just for ovarian cancer, that's for everyone. The federal government does a huge amount of investing in research for cancer because it affects so many of our citizens. And I would offer it's cancer research directly, but it's also basic bench science to help get us to the point where we might learn something new about cancer. So it's kind of down in the food chain as well. That's to the tune of, if you combine all the money, billions of dollars, it's significant. And right now we are all living through a pretty tumultuous time trying to understand what is happening around funding. I understand we are not in a political space. I'm just going to call balls and strikes. We had 1,100 people fired from the NIH this morning. We have seen huge amounts of funding either put on hold or put in jeopardy. I think the thing that is affecting most, and University of Michigan is the third highest recipient in the country of NIH research dollars. So you better believe the president of Michigan is knocking and beating down my door. What we understand, and the scientists in the room can talk about their experience, is that they're just not releasing grants and processing grants for research that is ongoing. So we have people in the middle of clinical trials that are like, do I have money to continue? We have people who were in phase 1, but they were, of course, expecting 5 phases of their research. So we're hearing from a lot of scientists that there's disruption, there's uncertainty, and I think no matter what, the top line number is going to go down. Now, other places in the government besides the NIH sponsor federal research. Strangely enough, the Department of Defense, as you mentioned, does sponsor particularly research on things that disproportionately affects female soldiers. So breast cancer, ovarian cancer, there's a whole kind of list. And one of the things, I'm on the Armed Services Committee, one of the things we've been talking about today is, can we maybe sneak some dollars into the defense budget that might have otherwise come out of the NIH budget to continue this research? And I know, lastly, I think a lot of scientists, a lot of people in this room understand the intrinsic value of research, but a lot of Americans don't. They don't understand that the new development, the new breaking, life-saving drug, the new thing that they want so badly for their loved one is a long process, a rigorous science-based process that takes time and money. What they do understand is the idea that if we're not developing those new innovative things, someone else will be, right? So in particular, a lot of the NIH funding that was going to the University of Michigan, the next likely competitor to be discovering the new drug, doing that rigorous trial process, will be China. And so we're dealing with the fact that the next new life-saving drug could come from a very different system with a very different testing process. So I think I'm not overstating it to say that the scientific community is being rocked right now by these changes. Everyone's just trying to buckle up and make it through. But the federal government has probably had some sort of hand in every groundbreaking treatment, medical device, and cure that you know of, because the federal government is just such a huge funder of that base science.
Dr. Salyer, can you talk a little bit about your research at VCU and how that's impacted along the lines that Senator Slotkin described?
Yes, absolutely. I just want to echo that, Senator Slotkin put the nail on the head. This is rocking everyone's world right now. I would say first, too, is that any gynecologic cancer is significantly underfunded. especially considering how deadly, especially ovarian cancer is. Like you look at like prostate cancer, for example, it has like 20 times the amount of funding. Yes, it is more common, but it is not nearly as deadly, right? So all the dollars often do not go to women's cancers in general. And then now we have all these huge changes that are coming. How are we going to fund our research, right? So I just came back from the annual meeting where all the GYN oncologists in the country get together. It's called SGO. And it's just sort of we're all in a state of crisis, right? You know, our research dollars come through like a combination of the NIH, the federal government, pharmaceutical companies, and then private donors. But the NIH is the big funder. And so, you know, as we've sort of seen in that video, it all starts in a lab. You know, it takes people in the lab developing these drugs, finding novel mechanisms for how ovarian cancer develops. We then get drugs that we can take to our patients, right? I was really touched by, I think that one of the moderators was saying that her mother was in her like second remission. And that's because of the research that's being done. Like how we treat cancer today versus 15 years ago is crazy different. We now have all these targeted therapies and novel ways to treat cancer that we didn't before. When women come to me in my office and they're like, oh my gosh, this is a death sentence, I'm like, actually, maybe not. And that's thanks to the research and the treatments that we have available today. So to suddenly kind of have this rug pulled out from under us, all these people in these labs have dedicated their lives to finding these novel ways to treat this disease, and to say, hey, you're suddenly fired, is devastating. So especially a lot of us, everything's just kind of on hold. Me, I'm a new researcher at VCU. I'm working with Dr. Mandon's lab. We found a novel mechanism in the development of ovarian cancer, and specifically there's a target you can measure in the blood called 2-stroma that's detectable in early stage disease. This marker also has a specific antibody drug conjugate. So we have so much potential, but it's kind of just in its early phases. Like, I need to take this to patients, but if there's no funding, it's not going to happen, right? And like Dr. Slotkin said, all around the world, people are doing this too. So
You called me Dr. Slotkin.
oh, sorry, Dr. Slotkin.
Senator
Slotkin. Thanks. You just got another title.
Yeah. Promoted.
Senator Slotkin said, this research is being done all over the world. So I don't know what that's going to mean for us. Yeah.
So let me turn this back to the senator. Can you talk about ways that what can people do to reach out to lawmakers? What can an individual person do to be heard on this?
I think your mic
Okay.
is off.
Okay. Try again. How about this? No? Now?
Here, you want to use this one?
Okay. How about this? Okay. Okay. So the question, I want Senator Slotkin to tell us, what can an ordinary citizen do to be heard on this? What suggestions can you give us?
So what I would tell you is going on, and what is being at least in part effective, is banging pots and pans with lawmakers, giving them human stories that touch their heart, and encourage them to call the administration to get exceptions for the cuts. That is basically what's happening. And there's no formal process, there's no form to fill out. It is literally getting to as many people as you can who feel so concerned about what's happening to an institution they love or to a set of research that they care about. And they make a phone call into the White House, and we see exceptions. This is happening. It's not more complicated than that. So what we're asking people to do, and what I know Tina Swish and others were on the Hill today talking to legislators, is explain this to legislators who, again, might be very supportive of lots of cuts. And again, I was in the federal government. Like, there's plenty of fat to cut. I think there's a responsible way to cut, and there's a reckless way of cutting. And so I encourage you to call, visit, engage, like old school democracy. The other thing that we're seeing work is basically having public events that get into the media in people's home districts, home states that you might not be able to get to. So for instance, we're poised to have some deeply significant Medicaid cuts. And while I'm guessing most people in this room are not on Medicaid, the number of things that depend on Medicaid that you do think about and you do care about. For instance, 65% of the nursing homes in Michigan are funded, at least, if not majority, in part by Medicaid. Most people care about their nursing homes, rural hospitals, that kind of thing. So we're doing like teach-ins and public events. We're asking people to write op-eds in their local paper. And I think when people understand, when legislators that I work with understand the threats, then they start to engage. So for instance, NIH cuts also affected the University of Alabama. And so the Senator, Katie Britt from Alabama, engaged on this issue a little bit publicly, but mostly privately, and is working on an exception for the University of Alabama. So you better believe I'm following that playbook, right? We are from different parties, but I'm gonna follow the same darn playbook to get that money for the institutions I care about. It's not how we should be doing it, it's not strategic, but it is literally who can you get to and how much noise can you make. Not in percentages, not in spreadsheets, but in human stories, I think is just really important.
Let me make a plug now for Tina's Wish. If people want to go on the Tina's Wish website and take advantage of the various podcasts and detailed information that's there, it's a way to get ovarian cancer information out into our community and to spread it among people that we know. So that's a minimum thing that we can do. And then let me switch back to kind of a wrapping up question for Senator Slotkin. Do you have any kind of a vision for women's health? Any goals for where you think this is going to go or what you personally would like to focus on?
Yeah, well, to be honest, right now we're trying to hold what we had 3 months ago, right? That would be a success story if we could hold on to some of the research in women's health issues that we had most recently and make the case. I think if we get out of the defensive mode and could think medium term into being more offensive. I mean, I think about just some of the statements that the doctor has made about how the disparities in what diseases and what things get funded. Like, I'm 48 years old. I'm a child of Title IX and women's sports, right? My mother didn't have any sport teams to play on. She was a good athlete, but there was no teams for her to play on. Title IX came around and said, if you're gonna have boys sports, you're also gonna have girls sports. You need to be equal opportunity on that. And Title IX gave me 3 seasons of sports that I played for 18 years. I wouldn't be here without women's sports and the leadership I learned there. I feel like we need like Title IX for women's health. Right? Like just make it even. I'm not saying like we need more, but like, and I'm not like discouraging research in other people's cancers, but like, can we have some balance in what diseases we research, since women obviously are 50% of the population. So I think there's interesting work to do there. I will say I am deeply worried in general about every single person in America either losing their health care or their health care costs going up in the next year. Between Medicaid cuts, the ACA or Obamacare subsidies that end at the end of this year, which the other side of the aisle has said that they are going to get rid of, and some cuts to potentially Medicare, I am deeply worried that we're going to have people lose their coverage. And then the hospitals, I had our big hospital system, Henry Ford Hospital, in my office 2 days ago saying, if I get more uninsured people in my ER, I got to raise costs for everybody else. That's just business. So I just want to put on the radar that we're talking about research, but the ecosystem of access to care for any hope of early detection, for any hope of just getting treated, right? I think about all the time, if my mother had had health insurance for those 5.5 years and went to see a gynecologist, and they would have said, you got to get a hysterectomy. You're a Jewish lady, you gotta get BRCA testing, you gotta get all this stuff. I think about the prevention that would have happened in the 5.5 years up to her diagnosis. And that's something that I think it pains me to think about in the ecosystem that we're about to enter on healthcare in general.
Thank you, Senator. Dr. Salyer, is there any wrap up that you want to say about your forward-looking view for where this is all going?
Yeah. I mean, it's how do we do that? We still have to move forward. People are still going to get sick. We're still going to have to take care of them. But it's how much does it cost, and how sick do they have to get before we see them? So yeah, I'm very fearful of that too.
Well, I'm gonna put in a shameless plug, and I'm saying, like, what's going on here tonight is going on in a million different disease groups, a million different interest groups, communities that care about a certain issue. And we know what's going to happen. When there's not enough funding, they're going to look for other sources, right? You're going to write to other organizations. People are going to go to their states, right? University of Michigan and other institutions are going to go to their state and say, hey, can you make up the difference? And then they're going to come to organizations like this, right? They are coming and saying, like, look, I'm losing over here, but this is something you care about. Can you help, mitigate the loss of those dollars? So that's my shameless plug, but there's no way to get around it. Philanthropy and the private donor community is going to be tasked and asked to help a lot more than previously. And I think thinking how you want to invest your time and your resources is just a really important thing to think through.
Yeah, I want to echo that 100%. Because right now we're sort of figuring out, hey, we've got all these projects, we're so excited, we want to move things forward, how do we fund it? And so everyone's just sort of in this holding pattern, but I mean, honestly, private sector funding is where we're going to have to go. Because pharmaceutical companies, they don't want to, I mean, they're wonderful, we need them, we love our industry partners, but they are more interested in treating advanced disease than preventing cancer, right? They aren't going to fund things like cancer prevention strategies. So that's all going to have to come from private sector. And especially moving forward, the word woman is on the DEI scrub list. So this isn't just affecting people of color disproportionately, but women in general. So kind of going back to your Title IX comment, it's getting worse. So I don't see how people in my field are going to get any NIH grants moving forward. I mean, we're trying to be smart about our language. When you write something, you don't say women's cancers, you say ovarian cancer, you take the word woman out. But how well is that going to work? We don't know. So really it is going to come to organizations like this to keep moving things forward so we can take care of people.
Well, thank you. I can't tell you enough how informative that was and how wonderful it was for this room to hear both of you. We really appreciate your advice and your information and your time.